So one of the greatest challenges working with the HD community is the ever-present clock on the wall, the awareness of time ticking down. My very first day at HDSA, I received a call from a grandfather who started off the conversation with, Louise, I know you're new to HDSA, but I need you to give me a time frame. I need you to tell me when there's going to be a cure for this thing, because I'm losing grandchildren at this point. And it's heartbreaking. It's so hard to communicate the tangible help that we have today, the doctors, the social workers, the support groups, the communities of families that can make living with Huntington's disease easier. But at the same time, we're still in uncharted territory when it comes to having disease-modifying treatments. I am very optimistic. There is great science happening. There are breakthroughs literally every year that are bringing us closer and closer to a time when HD won't be the burden that it is. But right now, as I meet with families, talk to them on the phone, I'm talking about hope that isn't immediate enough, and that just transition of time, generation upon generation, is exhausting, and I feel that.
Hopefully, if we hope that no one obviously has opens that letter and says that they're gene positive for Huntington's disease, but we do want them to know that if that does happen, that there's a family at HDSA that's there willing to support them. We provide care through our centers of excellence. So there are, as I mentioned, 41 centers of excellence here in the country that can provide those family members and patients expert multidisciplinary care, so they can turn to us for that. We also have a network of support groups and social workers locally that we support at HDSA. These are really the workhorses, the boots on the ground for the local communities. These are the folks that will help them, hopefully help them along the way with a lot of the things that they're going to need for their HD care, whether it's dealing with Social Security and disability, or just finding a long-term care facility locally for their loved one. We have those resources at HDSA as well.
All of our local HDSAs are run by family members. And so the leadership of HDSA is on the front lines every day struggling with this disease. And that means that as professionals supporting them, my team has to be very well versed at recognizing the role that a volunteer leader has in their family unit and in their community. So for some of them, they're active caregivers. A woman caring for her husband who's president of an HDSA chapter, and how she is managing her time. And then we have other folks who are at risk for the disease, and as they stay involved, become symptomatic. So all HDSA staff are actually trained by social workers on how to engage with symptomatic individuals, because, for example, if you have a teleconference with somebody from across the country, so you can't respond to verbal cues or physical cues, and you are talking about one topic, but then because you have them on the phone, you branch off in another direction, you could lose that individual. As executive function declines, it becomes very hard for them to switch gears and talk about something different. So we have to be sensitive to that. Making sure that we engage our social workers so that we can really support a family who we have a sense is struggling with something, and be able to sort of create a local triage of support to help out that family. But we're all caregivers, supporters, ambassadors, teachers, and advocates for our community. And I'm really proud that as an organization we're so consistently committed to that relationship with the people we serve.